Good evening, Mr. Gaines. How are you doing today?
I'm doing well.
My name is Dr. Sykes, and today I'll be your pharmacist. So the reason for this visit today is to do a general assessment on your vital signs and your overall physical condition. Do I have your consent to move forward?
Yes.
Okay, good. Okay, the first thing I'd like to do is take your temperature. If you don't mind opening up and place this on your stomach. Hold on. Thank you. We'll hold it there for about a minute. Okay, it's been a minute. Open up. Thank you. So your temperature reading was 36.4 degrees Celsius, and that's pretty good because for a normal body temperature it's 37. So I don't see no indications of anything going on in your body as far as an infection goes. Okay, now I would like to take your pulse. So I took your pulse rate, and as I was taking your pulse rate, I was able to watch your respiratory rate also. Your pulse was at 96 beats per minute, which falls in the normal rate. Normal rate is between 60 and 100. Even though you're kind of pushing towards that 100 range, you're still within a good range. And your respiratory rate was at 24. Now, normal rate is between 12 and 20, so that's kind of putting you over on the respiratory rate. So what is your profession?
I'm a bank manager.
A bank manager. So that means you must sit around a lot, or?
I mean, yes, it's very stressful.
Stressful too. So do you get any exercise during the week?
No.
Okay. Well, I would advise you try to get some type of exercise in, maybe on the weekends, or if you have family members that you're normally around, maybe try to do some outside hobbies to bring that respiratory rate down. So, okay. So now I would like to get your height and your weight over here. You want to stand on the scale?
So we're going to do the height first?
Yeah, we'll do the height first. Okay. Okay. Now, if you don't mind, turn around so I can take your weight.
Okay.
Okay. Thank you, Mr. Gaines. You can have a seat. Okay, so your height is at 6 feet, and your weight is 89.5 kilograms. So I took both of these numbers and I calculated your BMI, which is your body mass index. And this pretty much, it's a calculation that relates weight for height, and also it's a direct correlation with total body fat content. And at 26.8 for your BMI, that's kind of putting you slightly overweight. Normal range for BMIs is anywhere between 18.5 and 24.9. But for somebody at 6 foot, at your height, your stature, the normal weight range should be anywhere between 63.6 to 81.8 kilograms. And an ideal body weight for you would be at 6 feet, about 77.6 kilograms. Now I would like to take your elbow breadth. And this test is just, it's going to show what your frame size is. So if you don't mind standing up for me right here. And put your elbow up like this. Thank you. One more time. Thank you. And one more measure. Thank you. Let your arm down. Okay, another test that I'm going to perform on you is called a skin fold thickness test. This test, it's going to tell me and estimate your stored body fat. Okay, thank you, Mr. Gaines. You can have a seat.
Okay.
So for your elbow breadth test, I calculated 7.3 centimeters, and for a male, anywhere between 6.7 and 8.1 is going to put you at a medium frame. So your number lands between the medium frame, so it's telling us that you have a medium frame as a male. For the skin fold thickness, I measured 23 millimeters, and that pretty much puts you at the 87th percentile within your age range. So this pretty much concludes my general assessment of you today. Are there any questions that you have, maybe of your
Are there any things that I can do to probably bring down my blood pressure a little bit, or my respiratory rate?
Yeah, I would, like we talked about earlier, I know that you're a bank manager, I would, do a lot of exercise, try to get as much exercise in as you can. How are your eating habits?
Usually eat a lot of fast food because, I'm usually busy, so there's not much time for
Okay. Well, I would try to, on your days off, try to go grocery shopping for the whole week, and maybe get you some greens, some salads, something that you can fix up quick and bring through to work. So try to start eating a little more healthier. That'll help bring your blood pressure down. And like I said, just incorporate more exercise. And even if you have to park your car far away than what you normally do, that way you're getting a little more exercise in during the day. And if it's a multiple story building that you're in, maybe taking the stairs would help a lot. Okay. So is there anything else?
No.
Okay. Thank you, Mr. Gaines, for your time. Appreciate it.
Thanks.